Today, we're going on a journey deep inside the body to look at a full-blown crisis. It's a cascade that starts with a single problem we call shock, and if we're not careful, it can end in a total systemic shutdown. Let's trace how this all happens. So, this is the big question, right? How can one issue set off a chain reaction that brings the whole body to its knees? It's like the body's own defense systems get turned against itself. We're going to break that down. Let's dive in. All right, first things first. Everything, and I mean everything, starts with this initial alarm bell, shock. If we can really understand this first stage, we've got a shot at preventing the entire catastrophic cascade that can follow. So, what even is shock? Well, it's a lot more than just low blood pressure. Think of it as a red alert at the cellular level. The real problem here is something called inadequate tissue perfusion. It's a fancy term, but all it means is that your cells are literally starving for oxygen. And without that oxygen, they start to malfunction, and eventually they die. This is ground zero for the whole crisis. Now, this is a huge clue. I want you to really lock this in. Long before the blood pressure plummets, the brain starts to feel that oxygen shortage. This is called cerebral hypoxia, and it makes the person agitated, restless, maybe a little confused. So here's a massive takeaway for your exams and for your practice. If you see a patient who's suddenly agitated or restless for no clear reason, you need to be thinking about shock. It could be the very first sign. Okay, so if we're going to stop shock, we have to know what's actually causing it, because not all shock is the same. Let's get into the four main types, and you'll see how this builds our understanding. This breaks it down perfectly. Think of four different pathways to the same disaster. First, you have distributive shock. Imagine your blood vessels are pipes. Well, here, the pipes suddenly get way too wide for the amount of fluid in them. Then there's hypovolemic shock. That one's more straightforward. You just don't have enough fluid in the tank, maybe from bleeding or severe dehydration. Third is cardiogenic shock. This time the problem is the heart itself. The pump is failing. And finally, obstructive shock, where there's a physical roadblock, like pressure on the heart, that's stopping blood from getting where it needs to go. Four different causes, but they all lead to the exact same crisis: not enough oxygen getting to the cells. This really puts into perspective why every single second matters. Early on, you see the body trying to fight back, right? You get a fast heart rate, that restlessness we talked about. But if it's not treated, look at where we end up. Organ dysfunction, kidney failure, and yes, even death. That gap between early and severe, that's our window. That's where we have to act. And now, we've hit the tipping point. This is where things get really serious. An unresolved state of shock kicks off this massive, body-wide inflammatory response. And that's when the systems start to fail, one after another, like a devastating line of dominoes. This chart is a fantastic roadmap of how that happens, especially with sepsis. It all starts with SARS. That's just a body-wide inflammation. Now you add an infection to that, and boom, you've got sepsis. When organs start to get damaged and blood pressure drops, it becomes severe sepsis. And the final stage, septic shock, where the organs are actively failing. It's a clear, dangerous, and incredibly fast progression. And this is the end results of that devastating cascade: multiple organ dysfunction syndrome, or MODS. We're not just talking about one system having a bad day. This is a total system failure. As you can see, the official definition is when two or more organs need medical help just to keep going. The lungs, the kidneys, the liver, one by one, they're all starting to shut down. And if you want to understand just how severe MODS is, just look at this number. When four or more organs start to fail, the mortality rate is over 60%. That is a staggering statistic. It just drives home how incredibly lethal this condition is and why every single moment is absolutely critical. You think MODS is as bad as it gets, but believe it or not, there's another deadly complication that can pop up from severe shock and sepsis. It's this baffling condition called DIC, and it is a true medical paradox. Disseminated intravascular coagulation. Yeah, it's a mouthful. We just call it DIC. Basically, it's a systemic syndrome where the body's entire clotting system just goes haywire, usually because of the massive inflammation from shock or sepsis. And this is where things get so strange. It's a complete contradiction. On one hand, the body goes into a frenzy, forming thousands of tiny little blood clots all throughout the bloodstream. These microclots start blocking up blood flow to the organs. But, and here's the crazy part, in the process of making all those clots, the body uses up its entire supply of platelets and clotting factors. It's like it spent its whole emergency fund. So, on the other hand, there is nothing left to stop bleeding anywhere else. The patient starts to hemorrhage, uncontrollably. It's this insane, devastating cycle of clotting and bleeding happening at the exact same time.
So, with all this chaos going on in the body, how do we fight back? This is where the healthcare team, and especially nurses, play such a vital frontline role. Let's talk about the key interventions.
When you're a nurse managing this, you have some really clear goals. Number one, control whatever started this fire in the first place. Stop the bleeding, fight the infection. Number two, promote perfusion. Do whatever you can to get oxygen back to those starving organs. 3, provide nutritional support, because this body is under an incredible amount of stress. And finally, number 4, maximize comfort. These are really the 4 pillars of your care plan. So at the bedside, how do you make that happen? Well, you're going to keep your patient warm to support their metabolic needs. You're giving medications through an IV for fast action. Because of that potential confusion, you're keeping the side rails up for safety. And of course, you are glued to the lab work, watching things like the CBC, BUN, and especially lactate levels, which are a direct signal of that cellular oxygen starvation. So we've come full circle, haven't we? From one subtle sign all the way to a potential systemic shutdown. It all comes back to this one idea. That little change, that moment of new restlessness or confusion, that could be the very first domino starting to wobble. It could be your chance to stop this entire catastrophe before it truly begins. The question isn't just whether it can be stopped, it's, are you prepared to be the one who sees it first?